I think we can start now. Okay, hello everyone, and welcome to our first online research round. My name is Balak Tati, and it's my pleasure to introduce our speaker today, Dr. Sharon Gabison. Dr. Gabison joined Kite in April 2018 as a Halsey postdoctoral research fellow in technology for family caregivers. Her research in pressure injuries, along with her clinical background as a physical therapist, has led her to her interest in the development of technology and tools to prevent pressure injuries. She earned her PhD in medical sciences from the University of Toronto while she studied the relationships between trunk function, pressure offloading, and tissue health in individuals living with spinal cord injury. She is currently working on projects to support individuals with or at risk of developing pressure injuries and their informal caregivers. This is our first online research round, so some quick housekeeping rules. During the talk, we're going to mute the audience. Around halfway through the talk, Dr. Gavison is going to ask if there are any questions. At that time, you can type in your questions in the chat box and she'll answer. And at the end of the talk, we'll have another potentially longer round of questions. And again, we're asking that you type in your questions. So now I'm going to pass on to Dr. Gabison, who can start.
Thank you, everyone, for the opportunity to share my work with you today. As Babak has mentioned, I'm a postdoctoral fellow, research fellow here at Kite UHN, Toronto Rehab. And Toronto Rehab UHN, as you know, is a North American leader in rehabilitation science, whose mission is to transform lives of individuals living with disabilities in order to promote health, activity, and independence. I have the incredible privilege of working within an interdisciplinary team, including healthcare professionals, rehabilitation engineers, and academics that share a common mission to reduce the suffering of individuals and their caregivers that live with pressure injuries. So pressure injuries are one of the hospital-acquired injuries that Toronto Rehab has committed to reduce, and in fact is in our strategic plan, Sorry. So as I just want to declare that I do have a conflict of interest, I will be talking about an app today called Pressure Ulcer Target, and I do own the intellectual properties of the app. So pressure injuries are as a result of deformation caused by forces beyond what the tissues can tolerate. And they occur over bony prominences where tissue deformation occurs, damaging tissues, disrupting cells, and reducing circulation. They're common in individuals with limited mobility, including wheelchair users and individuals confined to bed. These pressure injuries can result in mortality, in morbidity, and in worst case scenarios, mortality. So pressure injuries are rated on their severity based on the extensive damage given, and they're given a rating scale from stage 1 to stage 4. And stage 1 pressure injuries involve the epidermis. They're identified as non-blanchable erythema in which the tissue, when pressure is applied, does not turn white. And these are early and less serious stages of pressure injuries, whereas stage 4 pressure injuries, on the other hand, go all the way down to the bone. And there are 2 additional stages of pressure injuries, stage X and unstageable, and suspected deep tissue injury. And with suspected deep tissue injury, the injury occurs deep in a tissue's overlying bony prominences and migrates up to the tissue surfaces. So wounds are a huge problem in our healthcare system, and they're quite costly. In Canada alone, 50% of our home care budget is spent on managing pressure injuries. And in Ontario, depending on what sort of financial model you look at, treating a wound in Ontario can cost over $10,000. And they're one of the most common reasons for individuals who are living with spinal cord injury for rehospitalization. Not only are pressure injuries quite expensive, but they have a huge impact on individuals living with pressure injuries and their caregivers. And not only do pressure injuries affect the quality of life, but they cause tremendous suffering and pain, not only for the individual living with a pressure injury, but also those looking after them. So the problem is that the effect of pressure injuries are not realized until it is too late, and after one has actually occurred. So in fact, most of my postdoctoral fellowship has been funded by the Halleses, who experienced just that, not understanding the prevention and early detection of pressure injuries of their late husband and father before it was too late. And this has inspired the work of the topics that I'm presenting today. So it's quite obvious that the need for early awareness and identification and prevention strategies are needed to promote behavioral change. And although we know best practice guidelines recommend pressure offloading at least every 2 hours, and in some cases every 15 minutes for wheelchair users, we know that adherence is low. So our first step in tackling this problem is to work on technologies for the identification of pressure injuries and develop the technologies for the prevention and management of pressure injuries. So I'm really excited to be sharing the results of 5 of these technologies, which have been developed for the healthcare provider and the individual with or at risk of developing a pressure injury, or their caregiver who looks after them. These technologies can be used at the bedside in inpatient and outpatient settings and out in the community. And with the exception of ultrasound imaging, they have been designed both for the individuals who are immobilized in bed and for those who use a wheelchair as their primary means of mobility. So the first technology I'd like to speak about relates to the identification of deep tissue injury using ultrasound imaging. So the ischial tuberosities are the primary sit bones that bear most of the weight in sitting. And these are the areas that are most susceptible to developing pressure injuries in wheelchair users. And deep tissue injury is a form of pressure injury that occurs in the soft tissues overlying the bony prominences and progresses up to the skin surface. And by the time the injury has been identified at the surface, tissue damage is extensive. So one suggested technology that can be used to detect deep tissue injury is ultrasound imaging. And ultrasound has been used to characterize tissue health in different conditions. In areas where tissue damage has occurred, areas appear in the ultrasound images as dark on the images and reflecting tissue edema. And these problem is that few investigators have quantified or characterized the health of tissue overlying the ischial tuberosity using quantifiable measures from grayscale analysis. So I set out to answer the question if I could reliably characterize tissue health in an able-bodied cohort using ultrasound imaging. So images were acquired in the side-lying position in 10 able-bodied individuals. 3 images overlying the ischial tuberosity were obtained, and each image was imported into MATLAB and into a customized MATLAB program processing toolbox, and partitioned into 3 areas of interest: the skin, subcutaneous tissue, and the muscle. Once imported and partitioned into MATLAB, each pixel in the region of interest was assigned a value from 0 to 255, where 0 corresponds to black and 255 corresponds to white. And anything in between these 2 values is assigned a number corresponding to a specific grayscale value. So descriptive statistics were used to obtain mean and maximal thickness measures of each region of interest and mean echogenicity values in each region of interest. So that's like the mean grayscale value. And additionally, we calculated a value for tissue texture, which we term contrast, where each pixel intensity is examined to its neighboring pixels in 4 different orthogonal directions. So a picture with 0 contrast would mean that the pixels were all the same value. And we use what's called the generalizability theory to calculate the source of variance and to determine how many images would be required to obtain reliable estimates of tissue health. So we used a threshold of 0.75 according to Portney and Watkins that represents good reliability. And as can be seen here, at least 2 images would be needed to capture reliable estimates of these measures when using a single evaluator at a single time point. Additionally, we sought out to determine how many images would we need to detect a true difference in repeated follow-up measures, we found that in order to identify a true detectable change of at least 20% on repeated testing, averaging at least 3 images would be needed. And the bottom line is that if we were to capture ultrasound images from a single evaluator at a single time point, you'd need at least 3 images to obtain a reliable and sensitive estimate. So we sought out to test this in individuals living with spinal cord injury and wondered, given that individuals with spinal cord injury have problems with positioning, we wanted to determine if there were differences in our measures between the supine and sideline positions for image capture. So we tested 2 positions, supine versus lateral recumbent, in individuals living with spinal cord injury. And while we examined the same measures, we found that echogenicity in the muscle was significantly lower in the supine position versus the lateral recumbent, suggesting that we should consider positioning and its effect on potential regional circulation. So what does this mean and how can you apply this information clinically? So, as mentioned, deep tissue injury occurs in the deep tissues overlying the ischial tuberosity prior to the appearance of skin breakdown. So we have found a way to assess the health of tissue at the bedside using ultrasound imaging. And we know that we need an average of 3 images to obtain reliable estimates of tissue health and to be able to determine if there is at least a true change in thickness and echogenicity measures of these tissues that are not attributed to chance variation. So the next technology that I'd like to speak about is SensiMat. So SensiMat was developed by David Moravian, an engineer, and our senior research scientist and KITE director, Dr. Milos Popovic. The device has a Canadian patent. So this technology has been developed primarily for wheelchair users who are at risk of developing a pressure injury. It can be used by the individual themselves or their caregivers who assist them. So SensiMat is comprised of a mat and an iPhone. The mat is placed under the wheelchair cushion, and the mat has 6 sensors, and these are the rear 2 sensors that go under the ischial tuberosity. So when pressure is applied to the mat, a change in voltage is registered and collected via Bluetooth technology to an iPhone. And what SensiMat does is alert the wheelchair user or their caregiver via a tactile or verbal prompt or audio prompt from an iPhone when a position change is needed. So additionally, for research purposes, the data can be uploaded onto a secure server for analysis, thereby allowing us to determine if an individual has offloaded or loaded their ischial tuberosities while sitting in a wheelchair by looking at the voltage registered in each of the 6 sensors. So this is the SensiMat, and this is the iPhone screen interface. So it will alert the wheelchair user if a position change has not occurred. So we evaluated 15 wheelchair users who sustained a spinal cord injury and collected their offloading behavior during their day. And when we looked at the pattern of offloading under their sit bones, their ischial tuberosities, we found over the course of a day, more than half of these individuals did not offload their ischial tuberosities. And those who did offload their ischial tuberosities, more than half offloaded both of their ischial tuberosities, while 3 offloaded their left ischial tuberosity. And it's interesting to note that all of these individuals were right-handed and did not offload their dominant side, which have either been accomplished by a left side lean or reaching to their non-dominant side. So additionally, none of these individuals engaged in the recommended offload frequency, despite the fact that they did not sustain a pressure injury. And we have some potential explanations. So what does this mean clinically? So in essence, we can measure pressure offloading while people are sitting during their regular day. We find that despite not getting pressure injuries, individuals with spinal cord injury do not engage in the recommended offloading behavior. And our findings also suggest that perhaps since there are differences between the right and left sides or the right and left ischial tuberosities, we may want to consider hand dominance in reaching when managing individuals with spinal cord injury during the prevention or for the prevention and management of pressure injuries. I'd like to talk about an educational app, Pressure Ulcer Target, which we've been working on and further developing. So this app was developed in collaboration with Aaron Warkerton in 2013, who was a student at the University of Toronto in the Biomedical Communication program. This app is designed for wheelchair users or their caregivers and is freely available in the App Store. And if you're looking for it, it's under Pressure Targets. This app was developed with considerations of the motor challenges that individuals with spinal cord injury may experience. This app is comprised of 6 main modules, and they're depicted here in terms of when the app opens up. And it covers what skin is, what pressure injuries are, how they develop, how to prevent them, how to manage them, and how to perform skin checks and also engage in offloading. So I'd like to talk about how we applied both SensiMat and Pressure Ulcer Target on a small case series study. So one of the questions that we had was, could we provide information early in rehabilitation in order to change offloading behavior and improve knowledge of pressure injuries? So one would hope that with improving knowledge, it would help provide the motivation for individuals living with spinal cord injury to engage in the frequent weight shifting behaviors and thereby reduce the incidence of pressure injuries. In order to explore this question, we provided users with an app over a 3-week period. We also monitored weight shifting behaviors pre and post provision of Pressure Ulcer Target using SensiMat. And we found that the provision of this educational intervention didn't change offloading behavior. However, it improved the knowledge of pressure injuries. And we used the Pressure Ulcer Knowledge Test, a modified version of that. And because we were really surprised that this pressure offloading behaviors did not change, we wanted to get firsthand knowledge from wheelchair users what they thought of Pressure Ulcer Target. So using semi-structured interviews, we interviewed 9 individuals living with spinal cord injury, and we asked them what they thought about the app. Interviews were transcribed and coded, leading to the development of themes and sub-themes. So 4 main themes emerged, which were overlapping. So users spoke about the key concepts presented in the app and activated as motivators to engage in offloading behavior. Users also spoke about who they felt would most benefit from the app, relating to the literacy level of the end user and when they should be introduced to the app. Users also spoke about the strengths and weaknesses of the app, which related to the navigation of the app, the aesthetics, and they also provided recommendations for improvement of the app relating to accessibility and additional information that can be included. So I'd like to read you some quotes for now that are quite interesting. So it takes a long time to get rid of it, pressure ulcer. This really nails it. With a stage 3, it can take more than 2 years. It's wow. Oh. It made me much more aware of getting my weight off my backside and doing those pressure reliefs. If you could throw in some real images to scare people, might be even good. And that quote, and that wasn't the first one, that was only the pseudonym Greg who talked about it. It was actually quite remarkable. As clinicians, we often think we shouldn't really scare our patients so much, but some of the people wanted actually real life images. So what does this mean clinically? How can we use this information to help individuals and their caregivers? So the study shows that we think we know what patients and their caregivers need, but we really don't, highlighting the need for a co-design approach when developing educational tools. This study shows you that the clinicians must be aware of what educational needs are of individuals and their caregivers for prevention, pressure injury prevention and management. So I'd like to spend the last portion of my presentation speaking about 2 technologies that we're currently working on and where we are actively collecting data. And the first I'd like to speak about is pressure injury management and education, also called PRIME for short. So this device was developed by our research team and 2 of our scientists, Dr. Jeff Fernie and Dr. Tilak Duda. And this device is designed for individuals who are immobile and spend a lot of time in bed. The device consists of 4 sensors, which are located under the legs of each individual bed, which are highlighted here in green. And features are extracted from the sensor data, and using a machine learning algorithm, the individual's position in bed can be determined. And the goal of the system is to eventually prompt the individual and their caregiver who's at risk of developing a pressure injury when a position change is needed. So this is another view of how Prime is, and Prime will also incorporate a user interface, which is depicted here, and it will be incorporated into the daily lives of those at risk of developing pressure injuries and their caregivers who are looking after them. So the sensors will be placed under the legs of the bed, indicated here, and there'll be a box at the bedside table, which looks like something like this, that will be a touchscreen computer with an embedded user interface. And this computer will have access to all the alarm settings and can also have access to an education system. And the information could be mirrored on an iPhone or a tablet. And the user interface can be used for several purposes. It could prompt the caregiver when a position change is needed via text message on the phone or an audio or tactile alert. It can store information as to how frequent a person needs to be repositioned. It can teach the caregiver about pressure injury prevention and management strategies, and it can identify how at risk the person is in developing a pressure injury. So far, we've collected data on 3 different cohorts, so 20 able-bodied individuals in our home care lab, 10 individuals at home, and 3 individuals in the complex continuing environment. So I'd like to present our findings from our home care lab today. So we placed the sensors underneath the leg of the bed, of a hospital bed in our home care lab, and we used the camera over top the bed. And the camera served as ground truth comparisons for our estimates. So using 2 different machine learning algorithms, so feed-forward neural network and logistic regression, and a leave one out participant, we were able to demonstrate a 94.2% accuracy in predicting one of 3 different positions. So these bars correspond to how much data we use to train the algorithm with using the remaining data for testing. So 30% corresponds to training the algorithm with 30% of the data, and then testing the algorithm with the remaining 70% of data. And since this is lab-based, we've begun, as I mentioned, real-world testing and have completed testing in 10 healthy individuals at home and 3 individuals in our complex continuing care environment. So here is our data from 2 older adults in the home environment, and we have found that accuracy levels have been lower, so as high as 91.1. And this means that we may have to make some changes to our algorithm, and we've considered several variables that we're going to include in our algorithm, including accounting for the position of the head of the bed. So as mentioned, we've also been testing Prime in our complex continuing care environment. And the most surprising part of this testing, which we really didn't anticipate, was the difficulty encountered with collecting real images for ground truth comparison in the natural environment. So we provided staff with an opportunity to close the shutter of the camera when they did not want to be in the field of view, or when patient privacy was needed, for example, when changing, bathing, or perennial care. And we found that staff weren't really very comfortable in participating in the study, or because of the camera, or for those who were comfortable participating, forgot to open the shutter after they closed it. So we're currently feeling our way through some of these challenges. So as mentioned, Prime will also be comprised of an educational interface to support individuals with or at risk of developing pressure injuries. So to that end, we've been working on a study where we're interviewing caregivers, care recipients, and healthcare professionals to find out what they need to help prevent and manage pressure injuries. So this study is exploring what caregivers and those with lived experience need as it relates to pressure injury prevention and management. So we're collaborating with a scientist, Dr. Jill Cameron, whose research also focuses on supporting family caregivers using qualitative research methods. So far, we've interviewed 3 caregivers and 7 care recipients and 2 healthcare professionals. So I'll be presenting the results from the care recipients' perspectives. So individuals accessed information from a variety of sources, and you can see up here in the green tabs. So what surprised me with some individuals, what surprised me was how some individuals learned about preventing pressure and managing pressure injuries while observing their nursing staff perform care. This suggests that there may be opportunities for nursing staff and healthcare professionals who are doing wound prevention and management care to use these moments as learning opportunities for caregivers and care recipients. Perhaps we need to develop materials to teach nurses how to teach caregivers about pressure injury prevention and management. And the other thing was we also looked at some of the factors that would contribute to how they sought the information. And timing of information delivery was important. And this has also been reported in previous literature. So individuals and also their caregivers wanted to know what to do in the moment for their given situation. If they had a stage 2 pressure injury, they wanted to know what to do for a stage 2 pressure injury, not a stage 3 pressure injury. Caregivers and care recipients weren't really thinking ahead. And this really highlights how difficult it may be to get caregivers and care recipients to be proactive in pressure injury prevention, and how important it is to get people to think about pressure injuries for prevention. What was also interesting is that when caregivers and individuals experienced a pressure injury, so here they experienced a pressure injury, there were many concurrent emotions that came along with it. And it was in relevance to what they actually knew and what they wish they had known. So these emotions propelled caregivers and individuals to engage in certain behaviors, whether it led to advocating for their family members or themselves, or engage in pressure injury prevention and management strategies. So information about this study is very important as we develop the user interface of crime. And we know that other than being credible and accessible, information in the user interface must be provided at the right time with ample pressure injury prevention strategies. So the last things I'd like to talk about today is a device called Smarty Pants. And this device has been developed primarily for wheelchair users who are at risk of developing a pressure injury. Oops. So this device was developed by Dr. Vivian Wisharwar at the University of Alberta. Smarty Pants is a pressure ulcer prevention system that uses electrical stimulation to induce muscle contractions in the buttock region. By stimulating these muscles for 10 seconds every 10 minutes, the system approximates conditions that have been shown to change the local distribution of blood flow and tissue oxygenation, thereby maintaining tissue integrity and prevent the formation of deep tissue injury. Electrodes are instrumented in pants, they're bicycle shorts, as you can see here, or they're instrumented in incontinence briefs. So Smarty Pants has undergone feasibility testing in 4 care settings in Alberta. The results show a high level of patient acceptability and muscle stimulation following a 5-week implementation protocol where the product was worn 4 days a week, 12 hours a day. And also caregivers in the study indicated that applying the system was not disruptive to their routine and required a relatively low additional demands. So while preliminary results demonstrate success in Alberta, there's a need to evaluate the system within the Ontario healthcare system and in our complex continuing care environment. So we've been testing this device in our complex continuing environment at the Bickle Center with the incredible support of the staff there. So in summary, I've talked about how we can detect deep tissue injury using an ultrasound imaging protocol. I've also reported on how we can monitor real-time offloading behavior in wheelchair users and in bed. We've also talked about how electrical stimulation is being tested for the prevention of pressure injuries. And I've talked about the education for individuals and their caregivers for pressure injury education and the need to include the end users in the co-design approach. So really, it does actually take a team, not only to prevent and manage pressure injuries, but it really takes a huge team to translate research to clinical practice. So at this time, I'd like to acknowledge all the individuals who have been incredible in this research, and including funding from the Hallisey's for the Hallisey Postdoctoral Research Fellow in Technology. This is how I can be reached, and that's it. Thank you. Any questions at this time?
Thank you, Dr. Gabison. This is Babak-Tati. Everyone, if you have questions, you can type it in the chat room, or if you want to ask your questions, you can raise your hands in the participants menu, and then we can unmute you.
So the question that I'm getting is, what do you think would have helped the participants to actually change their offloading behavior? And that's like a really, really good question. And to be honest with you, I'm not really sure. The only thing that we're starting to get is from some of the qualitative research studies is as one of Greg had mentioned is including pictures of what could happen. The other thing is to provide like a prompting system when a position change is needed, and also to help impart prior to individuals going home and perhaps having a coach after they get home in terms of helping them identify early stages of pressure injuries and how to prevent and manage them. And then there's a question. I hope that answers your question, Jacqueline. Okay, good. Iris is asking a question. Do you have a sense of whether the issue with offloading is a lack of offloading or ineffective offloading? And how does that change your approach to solving the issue? Okay, that's a very, very good question. It may not necessarily, so there are some limitations with our offloading measurements. So we looked at pure offloading, and what we've heard from some of the clinicians and from reading some papers, it's not just the offloading, total offloading, but it's the change in offloading. So looking at what happens before the tissues are completely offloaded. And what is believed is that it doesn't necessarily matter that you completely offload, but even if you engage in a partial offload, that helps to allow the tissues to return to their initial shape. And unfortunately, within our paradigm, we only looked at pure offloading behavior and not what happens right before offloading. So that is one sort of limitation of our study and something that we're going to be looking at in the future. Does that answer your question, Iris? Okay, thanks. No. And then Brian's asking, is there any plans to evaluate how well Smarty Pants prevents pressure ulcer with feasibility studies looking positive? Absolutely, that's definitely something that we are looking to in the future. We first have to determine, obviously, whether or not it's something that can be used. We're first testing it in the long-term care environment, and perhaps we can move it out into the community and track individuals to see whether or not they're developing pressure injuries, and perhaps combine it with other measures that will allow us to investigate tissue health. Does that answer your question, Brian? Thank you. So Pam is asking, what do you think is the timeline is for transfer and use of these technologies into routine practice, and what are the best bets? Okay, so we talked about the valley of death, and I think it's something like 7 years, if I'm not mistaken. It took us about 7 years to get the Pressure Ulcer Target on the App Store, and that's pretty much a pretty good estimation. So I'm hoping, you know, because we've been working on this for so long, and then it's an iterative process, and we're using researchers and also working with end users on a co-design approach. Hopefully we can get this out into the environment sooner. Does that answer your question, Pam? I think so. And then Eder is asking, did you compare your results with other works using a smart bed as a source of real-time data? So we actually looked at, there was a study that was done in the United States, in Pittsburgh, by one of our collaborators, and they actually used a bed. And the way that they used their bed was to primarily for measuring the person's weight. So it was for patients who were to try to monitor whether or not there were any changes in weight. And we've actually found that our accuracy pretty much aligns up with their accuracy levels. And that's the only other study that we've been able to find that is comparable to our study. Any other questions? I hope I've answered those questions. No problem. Any other questions? Okay, now I can, as mentioned, I could be reached. If you do have any questions, I could be reached at these contact numbers. And I'm happy to answer any questions in the future. If you're looking for collaboration, we're also still actively recruiting. Obviously, because of COVID, things have changed quite a bit, but we still are actively recruiting individuals for our studies, sorry. It's been my pleasure.
Thank you, Dr. Gavison.
Louise is asking if these slides are available for anywhere to refer to. I can certainly make them available. I can send them off to Babac in PDF, and I don't know if there's like a repository that we keep slides. The other thing is you can email me, and I'm happy to send them over. No problem, Louise.
Sounds good. Thank you again. Wish there was an option for an online virtual applause, but we're all applauding our speaker. The video will be posted, and we'll also share the slides with anyone who's interested in having the slides. Thank you, Dr. Gavison, again. And I think this is going to wrap up our very first online research rounds. We'll have another one next month. We'll announce the details soon. Bye, everybody.
Bye-bye.